everyone, I'm Tanya Morrill and host of this episode of Pure IP's In Conversation With. Today we're introducing something new to Pure IP customers and we're focusing on a different side of enterprise communications. Telecom and network spend is one of IT's largest and most complex cost centers. Without the right visibility and control, costs can add up substantially and become difficult to manage. That's where Pure IP FinOps for intelligent cost management comes in. It's a platform that centralizes invoices, audits carrier billing, and automates reporting. I'm delighted to welcome today from Hackensack Meridian Health, or HMH. Welcome Frank Maciel, Accounts Payable Director, and Irene Errico, Accounts Payable Manager. We'll also be hearing from Clary Rosa Garcia, who's the Director of Sophia FinOps. So Frank, we'll start with you. HMH is one of the leading healthcare systems in the country. Can you give us a little bit of oversight into your role and the scale of operations that you oversee?
Sure. HMH has gone through a lot of changes since I first joined. We were just one hospital, and now we're growing to 10 major hospitals, and we have a few hundred physician offices. So we've gone through a lot of growth, integrations, and mergers. So became very difficult when it comes to managing some of the things we were doing as far as telecom and other things that Hackensack had going on at the time. So we turned to BCM to help us out. And it's been a great relationship so far.
Great. Irene, can you take us through a little bit your role as Accounts Payable Manager and what the kind of day-to-day management of technology and carrier invoices looks like?
Sure. As an everyday coming into work as a manager, you deal with managing technology, carrier systems, centralizing of invoices, the AP staff. And with the volume that we're building within the last 8-9 years, we have to have centralization, third parties to get the work out the door. And this way frees up AP staff and myself to work on other projects as we move along with other updates that we have in the AP world.
Yeah. Clary, going to you now. For organizations like HMH, other healthcare organizations, why is intelligent cost management particularly important?
Tanya, we talk a lot about governance and compliance in our work. And I think Frank and Irene just touched on a lot of those challenges that enterprises have. When you multiply the number of locations, the number of vendors, the number of invoices, technology invoices are just inherently complex to understand just because of their technical in nature. So when you combine all of those things, what Sophia brings and what we do is centralize all of that information so we can really provide controls around it.
Great. So let's go back to the last sort of 10 years, how the partnership actually began. Frank, you started working with Sophia FinOps in 2016 following a merger. What challenges did that merger create for your team?
So as we grew, and not just the 2016 merger, we had 2 hospitals, and then the Meridian merger, we inherited a lot of telecom lines, especially when we first started. Hackensack had a lot of turnover, new management, so things got lost in the sauce, kind of say. So we had open lines that were just being paid for but not being utilized. So when we brought Sophia in, they did an audit, and they found hundreds and hundreds of lines that we were paying for every month that we never even used. Fax lines and all different types of network lines that we had active and that we were paying for. So we saved a ton of money. And as we grew, when we brought on new practices, we found the same kind of issues where lines were that we were paying for, telephone lines, whatever it may be, and they're able to take control of those lines, centralize into one repository where we can get reporting and we can get cost savings.
Great. Irene, we talked about this a little bit when we spoke originally, and it was quite an interesting point. What made it difficult for sort of physicians and department leaders to stay on top of their billing and service management?
Well, when it's a manual process, invoices get mailed, they go to different locations, and they have to be sent over to an accounts payable department. By having BCM and putting that all together for HMH, took away all that credit holds, lines not being up, telecom not being dispatched out. But so it just brought a lot more stability through the telecom and phone bills that we have. And like I said, BCM did a great job, is doing a great job, but has grown also because we started with, as invoices came into the department, we would do a list and send them over. And as we grew bigger, it became where other people in the organization got involved, and has brought a lot of the physicians, hospitals, all the hospitals we had. You bring them all into BCM where we don't have all the worries about people's, phones not being working or their systems not being up.
Yeah. Clary, you've been here from the early merger days. What were the kind of first challenges that you and your team needed to address?
I think for an organization like Hackensack, where you have so many different locations and different practices, with a very short time frame to pay the invoices, I think that's part of the big challenge, is that you're working with disparate teams, different locations. So centralizing everything and doing it in a time frame that is going to free up AP and make sure the invoices are being paid on time. I think that was one of the challenges that we faced from an initial onboarding standpoint. I think since then we have been able to, because we now know the teams that we're working with, we have relationships with the carriers, so we can easily turn on a new account very quickly. But that took us a little bit to understand the complexity that Hackensack in particular had.
Frank, from our initial discussion, I understand you heard about Sophia FinOps through a recommendation. Can you tell us a little bit about how that came about?
Yeah, I think it was one of the HMH board members that had recommended the team. I think some of the telecom people had some reservations because you're coming into somebody else's world. But as we moved forward with the project, we found the team to be really good at what they were doing. They were concise. They provided all the details that we needed. We extracted data. We gave them what we needed as far as invoices so they can take over to manage the accounts. And as the process grew, all those phone calls that I used to receive from doctors screaming that they had no service went away, which is a real positive thing for HMH. And that's just why we kind of grew the program. Yeah.
Excellent. Good to hear. Irene, you guys started with about 250 invoices. What did those early months with Sophia FinOps look like for you?
We would just bring all the invoices. We would send them over to BCM, and they would be calling the physician doctors, because our lines are held and responsible for the doctor. So there was a lot of work BCM had to do to get those ownerships under BCM so these bills can move. But we went from 250 to 500 to thousands because as it grew. But I do have to say, BCM worked very closely with us. Pulled in, we gave them a list of all the accounts that were coming in as we were moving along, and they would give us a certain time frame where they would onboard them. But if there was any emergency, they would make the payment for us. This way, no lines would be shut down, and we would just keep moving forward.
Clary, this is obviously the first time Pure IP customers are going to kind of be introduced to Sophia FinOps. Can you give them a little bit of oversight into how it actually works in practice?
Yeah, absolutely. For us, it all begins with two things. One is the invoicing. So copies of all of the invoices is the first thing that we collect. And the second thing is really having an understanding of how the enterprise views, their locations and the kind of reporting that we're going to need to provide. Because once we combine those two things, we can then get the invoices coming in. We're not only getting them processed and coded and approved, but at the end of the day, what we also want to do is be able to use that information so that services are not getting disconnected. We understand what services are being invoiced. And like Frank mentioned, we can find some savings, right? From an optimization standpoint. What services are you paying for? What are you using? Is there an opportunity for optimization, and putting all of that data together? That's part of the process. We usually we try to go into production within 2 billing cycles, so about 60 days, to take off that load from invoice processing, which I think is the biggest time saver for our clients. And then continuously work to ensure that the inventory is updated and that we're cataloging all of their contractual obligations.
Right. Frank, over time, the number of invoices that we were dealing with through Sophia FinOps, that grew from roughly 250 to 1,000. What drove that growth?
Well, the mergers, as we,
Hmm.
when we first get announced, when it was announced to us that we were merging with certain locations or physician offices, we got an inventory right away from them. We got copies of their
Hmm.
invoices and we sent that over to Sophia, um, so that we can get that up and running for as quickly as possible. And like I said, it's an easy process. We get it over. The team does the job. It's one less thing that we need to do for that merger, because on top of bringing
Hmm.
over suppliers and taking over accounts and understanding and teaching them how to use our new systems, because you're talking about small practices, where they're seeing patients. That's the important piece of their practice.
Yeah.
They have to learn how to use our softwares and submit requests and things of that nature. So it's one less thing that we need to do, and it keeps their world running. They're not losing, connectivity or whatever it may be. So whenever we have any kind of mergers, BCM is always one of the first groups that we contact and say, hey guys, we got another one coming.
Great. Good to know. Irene, Frank's touched on it a little bit, but as new locations come on board, how, from your perspective, day-to-day sort of operations, how does Sophia FinOps help you integrate new services quickly?
So today, we have other divisions of HMH that are involved with Sophia to have all that information brought to them prior for like a new acquisitions that comes on board or a new physician practice that come on board. Try to be proactive and get all that information prior to the go live. And if we do receive any invoices while after they go live, the team will put it together, send an email out, send it to Sophia's team and say, hey, we might have missed this account number. Let's start boarding this up. And then we start the process. We'll pay we'll pay the phone bill or whatever bill we have, but then the onboarding will start. So as soon as we see anything come to the office, we check with Sophia because it might be in the process of onboarding or that one is not boarded. So we move very quickly to get them onboarded. So this way we don't have the credit hold, it's not even a credit hold. It's just, services not being provided to these physicians or even hospital departments that we have today. So that's our biggest goal is, we don't want any shutdowns. We want their systems to work when they come into the office in the morning. We want their phones to be working when they're, when patients are calling in. And that's that's the reward of having this, Sophia, is just knowing that, and there is somebody that we can call or email and get that office back and running as soon as possible.
That is a very good segue into the next part of the conversation, which is about impact. And as we've been talking, you guys have, you've kind of given some different indicators of how Sophia FinOps has been impactful for you. But Frank, how has Sophia FinOps changed your visibility across cost centers?
Well, the reporting wise, right? We're getting the invoices in a timely manner, so it affects their budgets. So if it takes 2 or 3 months and we're going to a different year, then you're having accruals and things. So on the accounting side of the house, it's quick. It gets loaded in one shot into our system. Once it gets recorded, it helps the managers with their budgets, basically.
Yeah. Irene, I think a lot of people are, they're fed up with manual processing. And it sounds like from what you deal with day to day, that, creates quite a big bottleneck. How has the shift from that manual processing to automation improve your workflows?
Tremendously. The last thing any manager wants is to have an AP staff do manual processing. So it comes through. We get an upload Excel spreadsheet from Sophie. It takes like maybe if everything is correct, which it is, it takes like 10 minutes to upload maybe 500, 600 invoices and the check out the door to all the providers. So it takes away a lot of work and time from the AP staff that would they would be doing if it was manual to a 10-minute upload and out the door.
And also for
Great.
an audit perspective, it's a controlled environment, right? New accounts don't get set up unless they're audited by us first or approved by us first. So when it comes to any kind of fraud, it kind of mitigates that risk.
Great. Clary, working with HMH over the past decade, what specific improvements can you point to in terms of cost control and reporting?
I think what Frank just mentioned, right? So we know who is supposed to be sending us invoices and where we can accept an invoice from, because it is the dual process where we are setting up the invoices and working with the suppliers. We are also working with the AP department in getting vendor ID, so there's that verification check. But also from a call center standpoint, one of the things that I think we have alleviated for Hackensack is for the budget department heads, we're sending them proactive reporting every month, so they're not only seeing a summary of their expenses, but they're also getting the detail behind it, because that was generating some questions, particularly around mobility. So I think that has been, pushing out those reports on a monthly basis has helped free up other resources so they don't have to worry about that reporting.
Mm-hmm. Okay, so closing now. Frank, you guys have been a Sophia FinOps customer for 10 years. I hope you will be for at least another 10 years. What keeps that partnership valuable for you?
Well, it just works. Right? If you want something that's going to be easy to implement and it works every month with no problems, we are actually in the process of moving to a whole new ERP, and BCM will be with us in our new journey to our new ERP.
Great. Irene, what advice would you give to other healthcare finance teams who may also be managing sort of similar complex financial operations like you?
Pull your manual processes, analyze them, find a company as Sophia to help eliminate the stress and and growing the staff to input manual invoices. So you have to really get into technology and outside carriers to provide in a large corporation to get that volume down. Plus, like Frank was saying, everybody else, the reporting is key, because reporting is what gives everybody their budgets, right? So I love the fact that Sophia has a great reporting tool, and any questions that I have been working with Clary and other people from Sophie, answers are done quickly. I do have to say that.
Great. So Clary, we're going to end on you. For other healthcare providers and hospitals watching, how is Sophia FinOps evolving to support those that are facing continued consolidation and cost pressures?
Sure. So, I think with everybody right now is embracing AI. In the coming months, we expect to be rolling out some enhancements that are going to be key in understanding the data and interacting with the data differently. As Irene just mentioned, that information is key to be able to have that control. So that is coming in the next few months. And just as we evolve, just continuing to support our clients the way that we have been doing, being responsive to our clients as we are with Hackensack and everybody else, and having not only the system, but the people behind the system in place to be able to do that.
Great. Well, that brings us to a close. So Frank and Irene, thank you so much for joining and sharing your experience and also the realities behind managing invoice complexity at this level. And Clary, thank you for highlighting how the partnership has grown over the last 10 years. As Sophia FinOps becomes part of the Pure IP portfolio, we now bring together global voice, global network services, and intelligent cost management in one integrated approach. For our US-based customers and viewers, if financial governance is an area of concern for you, please get in touch with us to learn more about how Sophia FinOps can complement your communication strategy. Thank you for joining us.